Hey, Dr. Vicki here. So I want to go through a scenario since I have 4 different patients with visual loss of some sort. 2 have macular degeneration, and of which they both have gotten visual improvement. One completely. One is, I want to say, probably 50% better. And then I have some others with other visual disturbances. So when you're looking at that, most practitioners they'll do an MRI and they're like, okay, well, you've got a deficiency in your occipital cortex, which is your visual cortex back here. But there are so many other systems that are related to vision, that are related to other areas of the brain. And then when you look at these other areas of the brain, there's a whole list of things that cortex does. So it can be maybe related to vision, probably not so much, but those neural connections are still there. So you have to break down what exactly is going on with this particular patient. That's why all of the paperwork is so involved. So it breaks down what areas of the brain may be deficient compared to other areas. So we may have, for example, we may have some sensory issues, and a lot of times that's present with a lot of different neurological conditions. So when you look at that, you've got to figure out, how are we going to make this situation better? So we try things and we see what happens, and if does this work? So there's eye patterns, that even visual fields that fire to different parts of the brain. So if you haven't taken the courses, your traditional chiropractor is going to look more musculoskeletal, which is good, because sometimes musculoskeletal things can be related, and you can do adjustments, and sometimes you'll see improvements with these things. So there are different scenarios that will help, but we have to kind of look at a little more broad perspective instead with our brush strokes, and not just pinpoint one thing, like a subluxation, which is a chiropractic term for a misaligned vertebrae, because that may not be the most effective way to handle the situation. So if you've got any type of neurological loss, give Souter Chiropractic a call. I can be reached at 303-385-3432, or you can reach me at souterchiropractic.com.